Good morning, class. Today we will be giving our presentation on pediatric dentistry to a group of medical pediatric residents who treat children ages 1 to 5. Pediatric residents have a rigorous work schedule, so we will be presenting to them on their lunch break. This presentation might be the first break they've had all morning, so we don't want to overload them with information. Our job is to give them the facts that they need to implement preventive strategies in their practice. However, we have to remember that these are our fellow colleagues, so we will be speaking to them using proper medical and dental terminology. Before we start, we want to go over all the information that medical residents currently know. But we know that medical school was a lot like dental school. We were thrown a lot of information all at once. We'd study it for our exams, and if we were lucky, at least 50% of that information stuck. In addition, all of these residents came from different schools, meaning some might have learned a little bit more about pediatric dentistry than others. So you may see us give the residents a reminder about what they have already learned throughout the presentation. Medical students know about general primary eruption time. They know that the teeth begin to erupt at around 6 months of age, and once their patient is around 2 to 3 years old, they should be able to see, if not all, mostly all of the primary teeth in their mouth. They know about oral hygiene. If a child is under 3 years old, their caregiver will brush the child's teeth with water. But for high-risk cases, they can use a rice grain of fluoridated toothpaste. If the child is between the ages of 3 to 6, their guardian can use a pea size of fluoridated toothpaste. And the rule, if a child can write their name in cursive, they can brush their own teeth. Lastly, residents have on-the-job training. They have all had different clinical experiences, but there is one thing they have observed, and that is how to communicate to their patients and their parents. So without further ado, we will start our presentation. Good afternoon, everyone. My name is Jillian, and I'm here with Avery, Kelly, Angela, Puri, and Brianna. We are a group of dental students from the University of Toronto coming to you today to talk about pediatric dentistry. We understand that this is your lunchtime, so feel free to eat while we speak. We even brought you some Timbits for a snack. If you get paged, don't feel the need to apologize. We will email you all of our PowerPoint notes to review if you missed anything. So just sit back, relax, and we will try to make this as quick as possible so that you can get back to taking care of your patients. We are confident that after this presentation, you will be able to take away 3 main objectives that you will be able to properly implement into your practice. First, we want you to identify 3 stages of caries lesions. Second, we want you to name at least 3 risk factors for poor oral health. And third, we want you to be able to suggest 3 preventive measures for poor oral health. I will now pass it on to Avery.
As pediatric doctors, you may be the front line of people who will see issues such as early childhood caries or trauma. Therefore, it is important to realize just how prevalent caries are. In fact, caries are the most common childhood disease. Almost 50% of Canadian 6-year-olds had early childhood caries in 2010, and this number reached as high as 98% in some parts of Canada. So, what is early childhood caries? This is the presence of 1 or more decayed, missing, or filled teeth, as you can see in the photo. It can also be referred to as baby bottle caries or early childhood tooth decay. There are a few important things to note about caries and early childhood caries. Firstly, previous caries experience is the best predictor of future caries experience. Basically, caries experience as a child can increase risk for caries as an adult. Therefore, it is important to prevent and recognize a parent's or child's oral health care behavior in order to avoid future disease. Also, studies show that there is an association between early childhood caries and the child's age at first dental visit, as well as the parental belief about the child's oral health. Therefore, if you hear a patient say, "You mustn't worry about taking care of your primary teeth because they will fall out anyway," be sure to correct them. Puri will now be explaining caries in further detail.
Before we get into recognizing the appearance of a child's oral health, I'm going to go over a few definitions important for understanding what a cavity is. Demineralization is the removal of minerals from the tooth. Caries refers to the actual disease causing tooth decay, and a caries lesion refers to the hole or cavitation caused by the disease. We know that your first instinct as a doctor is to look in their throats, but it's also very important to look at their teeth. The CDA recommends that children first see the dentist no later than 12 months of age. So up until their first dental appointment, you are the primary health professional that holds the important responsibility for looking after and assessing their oral health. The Lift the Lip campaign is an excellent resource aimed at providing parents and doctors like yourselves information about how to lift the upper lip of a child to look for signs of decay. I will now go over the different appearances of the caries lesions. There are 3 main stages of a carious lesion we want you to be able to identify. The first sign of decay is an incipient lesion, which will show as a dull white band on the tooth surface caused by demineralization. It's very important to recognize this stage because it often goes unnoticed by parents and it can be reversed with proper treatment. If left untreated, it will progress into the next stage, which is called a progressed lesion. This appears as a yellow, brown, or black band on the tooth surface. The last stage is called a cavitation, and the tooth can appear as a brownish, blackish stump or as a hole in the tooth. This is the most advanced form of a caries lesion and requires the most complex treatment, oftentimes requiring the child to go under general anesthesia.
Now we have a case study to demonstrate how you may encounter this. A mother with her 2-year-old daughter comes to see you, and after discussing habits and history, you become aware that the 2-year-old drinks sugary drinks from a sippy cup frequently, she has not yet seen a dentist, and her parents brush her teeth once a day. By visual inspection of her oral cavity, you see what is shown in this photo. What would be your diagnosis in terms of caries progression? Would it be A, incipient lesion, B, progressed lesion, or C, cavitation? You'd be correct if you were to say incipient lesion.
For Objective 2, we are going to look at risk factors. Getting to know a bit of the child's daily eating and dental routines and taking a look into their mouths can help assess if they are at low, moderate, or high risk of developing caries. And as Puri mentioned, you will likely see children before their first dental visit. Low risk factors that reduce the risk of developing caries and offer protection include regular visits to the dentist and any exposure to fluoride as it makes the teeth more resistant to caries. This can be from community water, toothpaste, or professional treatment. Moderate risk factors for developing caries are recent migration and children with special healthcare needs. Upon examination of the teeth, high risk factors would be if the child already has a carie, has plaque or white incipient lesions on their teeth, and other factors include if the child goes to bed with a bottle, which isn't water, they snack more than 3 times a day, have low socioeconomic status, or even if the caregiver has caries. Although caries are the biggest risk for children aged 1 to 5, as pediatricians, you will likely have parents bring their child with a dental trauma to you. 33 of 5-year-olds get a dislocated tooth from the bony socket, called a luxation, and this is the most common dental trauma for children within this age group. Specifically, boys between the ages of 2 to 3 are at the greatest risk, while their motor coordination develops and they familiarize themselves with walking, running, and playing. And the trauma most often occurs to the central maxillary incisors. Quickly, I wanted to show you some of the types of tooth luxations you may see. Essentially, the tooth can be pushed in and out of the socket in all directions, or completely out in an avulsion. For primary teeth, dentists will often choose to extract them, and don't try putting them back into place since the permanent teeth will soon emerge.